Welcome back. At least 600,000 Americans have problems with kidney stones every year. The symptoms can be excruciating pain as the stone moves from the kidneys. And Dr. Bob, of course, is here to tell us more about it. I'm going to let him explain that process. I am not a doctor. I'm not even going to begin to talk about kidney stones, but I have heard if you have them, it's almost unbearable.
It really is. It's one of the most painful things that people can experience. It's like having a baby before they had anesthesia. That's a lot of discomfort and a lot of pain. And they say that a kidney stone will even cause more pain than that. So let's talk about the kidney stone, what happens with that. Calcium, most kidney stones are made of calcium oxalate. And calcium floats around the bloodstream normally. It goes to the kidney normally. And then it's filtered out where it then goes through the ureter into the bladder, and we urinate the calcium out. If there's something that makes the calcium concentrate and form little crystals, then they can form crystals in the kidney themselves. Doesn't cause pain usually there. You can get infection there. You can get irritated and bloody urine from having calcium in the kidneys per se. But if you have a little stone that breaks loose and it starts going down the ureter and it stops in the ureter, then the pain is excruciating. It usually is in the back, goes down the front side, down the groin, and it comes in waves. So it's pulsating, and it's almost unbearable. And people can't get in a comfortable position. They're jumping that's a key to kidney stone pain.
So what do you do?
So what you can do is we have to go to the emergency room, be sure we've got the right diagnosis. So the diagnosis is usually with ultrasound or with special x-rays. You can see the stone in the ureter area. And then you can give medicine that actually increases the tone of the ureter, doesn't let the waves go, so it takes away the discomfort. And usually that stone will just pass into the bladder and then it goes out. Now that's the important part there, because when a stone does that, then you have the ability to analyze that stone, make sure that it's calcium oxalate. If it's so, you have to see what the calcium levels in the bloodstream. The hyperparathyroid, the parathyroid gland, is what controls calcium coming in and out of the bones. So if the calcium level is high, then we have to drink lots of fluids, be careful not to get dehydrated, and cut down on some of the foods that have calcium oxalate in them. Uric acid is another stone. People with gout frequently have an elevated uric acid, and they can form the same type of stones that cause the same kind of pain. So the diagnosis is made in the emergency room. The treatment long-term is in a doctor's office, usually a urologist, who guides with nutrition, activity, medication, hydration, and patient usually does well.
All right, Dr. Bob, great topic, good information as always. We appreciate you making a house call every Thursday.
Always nice.